Many people think that rotator cuff injuries only happen to athletes like quarterbacks and pitchers. But did you know that you could suffer a rotator cuff injury doing something as simple as painting a wall or hanging a shelf? So how can you tell if you've injured your rotator cuff, and what can you do to fix it? If you're experiencing pain during normal activities like combing your hair or putting on shirts, you may have injured your rotator cuff. Other symptoms include weakness or loss of range of motion. If your injury is minor, it can be treated with 48 hours of rest, ice packs in 20-minute increments 4 to 8 times per day, compression to help reduce swelling, and keeping the shoulder elevated above your heart when you're lying down. However, there are some symptoms that indicate you may have a more severe injury. You should see an orthopedic specialist if your shoulder pain is very intense or if it's lasted more than a week. If you can't use your arm or it feels weak, you should also have it checked out. When in doubt, visit an orthopedic specialist like the ones at Thousand Oaks Surgical Hospital. They can help you determine whether simple therapy or surgery is needed. For more information, visit our website today.